A new study out of the MUHC finds that adolescence and young adulthood are risky periods for those living with diabetes. Joining me now to speak about this is Dr. Meranda Nakhla, a scientist at the Research Institute of the McGill University Health Center and a pediatric endocrinologist at the Montreal Children's Hospital. Thank you so much for joining us, Dr. Nakhla.
Thank you for having me.
So tell us about the study's findings. Why is it a risky time for teens and young adults?
The transfer from pediatric to adult care is a risky time for teens. They tend to drop out of regular medical care, and they have a higher risk of complications related to diabetes, both short-term and long-term. Myself and my colleagues had felt that these challenges actually start at a much earlier or younger age than 17, 18. And so we conducted a study that was a population-based study. So we looked at the population of Quebec. We used health administrative data to look at that. So it was like anyone, their hospitalizations or visits to their physician or diabetes specialist. And what we did is we looked at all those kids living with diabetes in Quebec and wanted to see when do they drop out of care. And we had defined that as having more than 1 year gap between medical visits. And really, youth should be having regular diabetes care visits with their diabetes specialist every 3 months. So a year is quite a long time not to see it at your diabetes specialist. And we also wanted to look at short-term complications, such as hospitalizations or ER visits related to their diabetes. We looked at different age groups and compared that to the under 10-year age group. So under 10, it tends to be parents that are looking after their child's diabetes. But then as over 10, they become tweens and teens. They start to want more autonomy and start managing their diabetes on their own with the support of their parents. And what we found was that, as we had thought, that these challenges do happen at a younger age. So we did find that teens started dropping out of medical care at around 15, 16 years of age.
Why is it important to improve that healthcare delivery to those younger adolescents?
Because really, when they're under 10 years of age, a lot of our education is done with the parents, because it's mainly the parents that are looking after their child's diabetes. But as they get older, the child is becoming older, taking on more responsibility, wants more autonomy, and it's really providing education and support for them on that transition from childhood to adolescence to adulthood. And then at the other end, we have adolescents who are 17, 18 years of age, where we're trying to prepare them for adulthood. So there's a bit of a gap for those younger teens on preparing them on taking on more responsibility of their diabetes, improving their confidence in themselves and being able to manage their diabetes as well.
Thank you so much for joining us, Dr. Nakhla.
Well, thank you for having me.